Hello and welcome to this Respiratory Catalyst podcast. I'm Jenni Quint and I'm a Professor of Respiratory Epidemiology based at Imperial College in London, and I'm the Associate Director of the Respiratory Data Science Catalyst. This is a unique partnership that's funded by Asthma and Lung UK and delivered by Health Data Research UK, and our overarching mission is to try and encourage and improve the use of respiratory data in innovative research. In our Respiratory Catalyst podcast, we're going to be talking over time to various different data providers to give us a unique insight into how to access their health data and why their data is important in answering respiratory research questions. If you haven't used health data in your research before and are unsure where to start, this is the podcast that will help you understand what is needed to access it. For today's episode, it's my absolute pleasure to be speaking with Andy Boyd, who's director of the UK Longitudinal Linkage Collaborative, also known as the UK LLC. Andy, thank you so much for joining me.
Oh, it's a pleasure, Jenni. Thank you for inviting me.
So to kick us off, Andy, tell me, why would I want to use UK LLC data to answer questions about respiratory disease?
Well, at the heart of this answer in this story is the fact that the UK has got a wonderfully rich tradition of running consented longitudinal population studies. This is a form of research where participants are invited to take part in research over decades and whole lifetimes and generations of families. And the study works with their participants to collect very, very detailed data on a wide variety of topics. I mean, these are incredible studies. They're so broad and deep in terms of depth of data, and the information in them has been used for amazing research for decades. And while this has been going on in the background for a very long time, the way these data have sort of like emerged over the years in studies means that not all studies have clear access mechanisms, and not all studies have been able to enhance their data by linking the participant survey data with participants' routine records. And this gives incredible utility. And UKLLC is working in partnership with UK longitudinal studies to really enable this to happen at scale. And that's the story. So, for example, decades ago, Doll and Hill used a longitudinal study collecting data on GPs' smoking habits linked to mortality register to find out that smoking is associated with cancer and cardiovascular disease. Obviously, it's like an incredibly impactful use case. But establishing those linkages between study data and linked routine records is incredibly difficult, it's incredibly costly, and not all studies are able to have access to the resources needed to make that happen. So at LLC, we formed a partnership of 22 longitudinal studies and growing. And those studies have deposited data on over 400,000 participants into our national trusted research environment. What we've then done is systematically link those 400,000 participants, where permissions exist, to their health records in England and Wales with Scottish Data Company. And also, we've got agreements with HM Revenue and Customs and Department of Work and Pensions to link employment earnings and benefits data. And we're also linking participants via their address data in a privacy-preserving way to their information about the environment, such as air pollution data and meteorological climate data, but also information on neighbourhood risk factors, such as vape outlets and stores, and also on homes, such as information about energy performance investments like insulation or the use of gas stoves or wood-burning stoves as a risk factor. So what we're pulling together has all the richness of wonderful depth of data that studies collect, plus these linked routine data in one package made available to UK researchers.
So, Andy, that sounds absolutely amazing. What types of respiratory questions could I ask? If I'm new to all of this, and that sort of all sounds a little bit overwhelming to me, can you just throw out the kinds of questions that I might be able to answer using the data?
Yes. I mean, the star point of that answer is actually, it could be anything, really. And I know that doesn't help with the fact that this really is an overwhelmingly broad depth of data. It's so broad I can possibly hope to do justice to describing what that is. I suppose, so what I'm going to do instead is point out that some of these studies, many of them in fact, have direct data collected on respiratory health. And some of them indeed focus either on respiratory health research or on sort of aligned issues, like their occupational cohorts. And they might be following participants whose occupation have direct risk factors relating to respiratory health. So instead of going to the depth of what they're doing and therefore what the questions may be, I'm going to just outline some of the key advantages of the cohort data, and particularly the cohort data linked collectively in a UK LLC. So to start with, it's this, I've mentioned depth of data quite a few times. So the studies are collecting much richer data on participants than is available in participants' routine health records. For example, not only on symptoms, but on behaviours and risk factors. So as an example of this, if you are researching something like vaccine effectiveness and vaccine hesitancy, the studies will have information not only on the electronic health records will indicate whether a patient has taken up their seasonal flu vaccine, but the cohorts will collect data on why they have or haven't. And is it due to concern over their health or vaccine hesitancy in general, or the fact that they feel they're young and healthy and it doesn't apply to them? So it's that depth of data is one of the key advantages. Another advantage is that the cohorts collect data outside of clinical settings. And that includes data on early symptoms, which participants are feeling and reporting to their study through data collection, which they're not reporting to the health services. It's before they engage with clinical interactions. So with all the current emphasis on policy development and understanding upstream health and how we can intervene earlier in people's care and patient pathways, the cohort data has information in this space, and not only directly on sort of symptoms such as wheeze, but also on the factors which surround that, such as their smoking or cohabitation with people who smoke, and other factors which might be driving wheeze or respiratory challenge. The third advantage is LLC, like the cohorts, is bringing data together across different themes. It's not just about health data. So we are linking health data, and the studies are asking a lot of questions about health data, but we're also bringing in these data about environmental data about air pollution or data about employment and earnings. So some of the grand challenges and ingrained inequalities we have in our nation, the answer to those issues lie in cross-cutting data sets. So LLC, with the partner studies, provides a unique opportunity to look at issues like workplace exposures and respiratory health outcomes, such as people in the building trade with all the dust and other particulates they're exposed to and their respiratory sort of outcomes. And then that is very topical at the moment and can contribute to evidence, for example, the Keep Britain Working review, which is underway in government at the moment, or strategies to boost and so keep people active in the workplace and not impacted, for example, with NHS staff, with their impact from seasonal flu and their absenteeism due to ill health. And finally, just to reflect on the fact that longitudinal data are deep and broad and wonderful, but like all data, they're potentially dirty and have biases and strengths and weaknesses. And this is obviously the same with routine records as well. And by bringing together both self-report data and routine records in UKLLC, we're able to inform research which is trying to understand the relative strengths and weaknesses of different types of data and to inform assessments of quality and bias in routine NHS data to improve that potential for national research use in routine records.
Amazing, Andy. Thank you. And for those of you listening who are now intrigued and inspired by what Andy said and want to access the UK LLC data, we've provided some links for you to be able to find out more about how to use the data and the processes for accessing the data. So that brings us to the end of today's Respiratory Catalyst podcast. Andy, thank you so much for chatting with me and telling me all about UK MLC.
You're very welcome. I've enjoyed it immensely. I hope it's helpful. And I look forward to contacts from interested researchers.
Fantastic. Thanks very much to those of you who've listened to this podcast. Please subscribe or get in touch with us if there's more detail that you want on any other topics, because we would love to hear from you. And head to the podcast description for our email address and ways to stay updated. Thanks very much for joining us, and we'll see you soon.